go ahead and let me know where you're going to be, going, so that we can basically find the best vaccination and many medication recommendations, other kinds of things that you need. Pardon my appearance today. I sometimes look a little bit messy. I know a lot of the rich girls in medical school would get their jackets tailored, but I felt like my money was better spent on other things, like on medical equipment. So that's what I saved up for instead of getting my jacket tailored so that it looks all fancy and pretty. Where are you going to be going today? Let me know where you're going to be going, and then we're going to go ahead and evaluate you. I'll go ahead and get some gloves on right now. Well, don't make me guess. Don't make me guess where you're going. Come on now. Let me know where you're going. Oh, there's just a little something. Is it okay if I touch your face? A little something on your face here. Just a little something. Just a little something on your face. Italy. Perfect. And how long are you going to be there for? Oh, let me just check this over here. Oh, it's nothing. I just thought I saw something there on your ear, but that's okay. How long are you going to be on your trip for? Don't make me guess that either. 3 weeks? Perfect. Okay, 3 weeks in Italy. So the first thing, let's do a quick physical exam, and then we'll pull out some of the Yellow Book guidelines, okay? So the first thing I'm going to look at, I'm going to kind of start top down. I'm just going to kind of look at your head real quick, your scalp health, okay? And over here, looking at your scalp. Just here. Okay. Looks good. Let me go ahead and look. I'm going to look in your ears now, okay? And as you know, always, everything here on Twitch comes with its standard disclaimer. I'm a real physician, but here in this secret place, anything that we talk about is secret self-care for you only. Nothing official, right, to diagnose or treat any kind of illness. Let's go ahead and take a look here at your ears. Let me get you a little protector here for your ear. Have you had any problems with your vision lately? And have you been traveling recently in the past? Okay. And then what have you, can we go over your chronic illnesses again? What kind of chronic illnesses do you suffer from? Okay. Let me go ahead and check in your ear over here. We're just going to check right here in this ear. What I'm looking for is I'm looking for exudate and erythema, and I'm looking for any kind of changes to the ear canal, bulging of the tympanic. I don't see anything like that. Okay, other side over here. Just a little bit over here. Okay, same thing over here. I'm looking for exudates, erythema. I'm trying to see if you have any kind of bulging in your tympanic membrane. Okay, perfect. Alright, so your ears are looking fantabulous. Okay. Yep, I've got my little black bag here. And then we'll switch out the head of this lovely little tool here. This is what I spent my money on instead of getting tailored and getting pretty. This is actually a pretty expensive little piece of equipment. and I'm very, very glad to have it because it makes it a lot easier to see in the eye than some of the other equipment that's out there. So I like it. I'm glad to have it. I am a disaster though. Okay, so we're gonna go ahead and we're gonna look in your eye. We're gonna not look in your eye backwards. Let me just see here. Let me just see here. Okay, and then the other side. And so what I'm looking for here is I'm looking for any kind of changes, specifically to the blood vessels, trying to see if your optic nerve has any kind of unusual edema. We try to identify at least a couple blood vessels, looking at the optic nerve and identify the fovea or macula. Some of these things are kind of hard to do, but again, this is a really good piece of equipment, and that makes a huge difference. There is a statement, you know, it is a poor workman who blames his tools, but on the other hand, you are not so much better than your tools sometimes, right? People, there's all kinds of conflicting folklore out there with terms and other things like that. But, alright, so that's good. Just a really quick question. Can you read this letter for me? Just this letter right here. And then this letter. And then this letter over here. Here and here. Perfect. Okay. So the next thing we're going to look at is I'm going to go ahead and we're going to listen to your heart and lungs. Does that sound good? I'm glad you've always had good vision. That's excellent. Just going to go ahead and listen to your heart and your lungs. Just your heart and lungs. And what we do is we always listen in 4 different spots. So first we listen in the aortic spot, then the pulmonary spot, then we listen next to your sternum in the tricuspid spot. And then we're going to listen under, you know, kind of under your rib on the side there. Basically, we're listening to your mitral valve spot, or ideally, I'll listen right under the bottom of your breast. Perfect. Okay. Go ahead and take a deep breath for me. Just nice deep breath in and out. And out. And again, in and out. In and out. Perfect. And then listening here in the back. Okay. Just go ahead and take a deep breath. Take a deep breath in and out. In and out. Perfect. Well done. Another deep breath right here. In and out. And again, deep breath. In and out. And a couple more times here on this side. In and out. Great. Then we're going to listen on the other side, okay? So, same thing here. Deep breath in and out. Deep breath in and out. And again, deep breath in and out. And again, deep breath in and out. Perfect. Alright, and I'm just going to listen to the top of your lungs right here. That's this area right here. So take a deep breath. And out. Great. And then over here, a deep breath in and out. Okay. And then just real quick here in the back, can you go ahead and say 99 for me? And again. Perfect. And other side over here, go ahead and say 99. And again, 99. Nicely done. That's excellent. Excellent, excellent. Okay. So real quick, just a couple other intro questions. Have you had any headaches recently? You know, or really, really strong headaches? Things that have been particularly unusual for you? Oh, I have to change my hair, don't I? Pretty terrible. Let me finish examining you, then we'll ask the questions with my gloves off so that I'm not contaminating you. Hi there, Compacus. We're doing an active RP today, so you can feel free to answer the questions as I ask them to. You guys are all one person, and you're going to Italy for 3 weeks. So you're getting your travel medicine exam. Let me listen to your belly real quick. This thing really is messing up my hair, but I can't touch it because that would contaminate you, wouldn't it? Alright, listen to your belly. Okay, and what I'm looking for here is I'm trying to listen to bowel sounds, okay? And here. Perfect. Alright, so now what I'm going to do is I'm actually going to tap on your belly. I just need you to lean back a little bit, kind of lie down a little bit for me. And I'm just going to tap on your belly here. And that's a real thing. That's something that we do to see if there's areas where there's too much fluid, and kind of also measure the size of your liver, okay? And then over here, and here, and here. And then here I'm going to just measure the size of your liver. Alright, so you're going to feel me pressing in deep underneath your ribs. Can you take a deep breath? Perfect. What I'm doing there is I'm checking your gallbladder. And then over here on this side, I'm going to check your spleen. It's going to be kind of uncomfortable, kind of squeezing in. I need you to take a deep, deep breath. Perfect. Okay. Do you feel any tenderness in any of these places when I push down? No? Good. Okay. And then if I push down a little harder, how about here? If I kind of... Perfect. So what I'm doing there is I'm checking for what's called a rebound tenderness. It helps us to evaluate for things like appendicitis. And then, let's see, let me have you lift your knee. I'm going to kind of manipulate your knee from the side here. Just kind of lift it up. And then have you kind of roll over on your side a little bit. Perfect. And I'm going to kind of pull your knee behind you. Okay, perfect. Alright, you can go ahead and sit up. Something on your face. Here you go. Keep you from being too uncomfortable. Okay, perfect. Very well done. Very well done. Alright, one more thing while you're sitting up. I'm just going to tap on your back, okay? And then over here on this side. What I'm looking for there is something called CVA tenderness. I'm looking to see if your kidneys are having any issues, basically. So, alright, well that's most of our exam. Let me answer your questions. And what we'll do is we'll go ahead and as we kind of look into, I'm actually going to ask you some questions first about some of your health background. And then after that, we'll kind of go through things with the CDC Yellow Book. And then, you know, since we're hanging out, we can actually go through this survival guide together that I've been looking at. You probably won't need it for Italy, but you never know. So just for some background, the CDC Yellow Book. The CDC Yellow Book is how travel medicine physicians find the most up-to-date information about what diseases are going on in specific regions of the world, right? So like if you're traveling somewhere where malaria is endemic, lets me know I need to get you malaria pills. If you're traveling somewhere where we need to get, you know, a yellow fever vaccine, I can get you that, all that kind of stuff. So, and like I said, I apologize for my hair and for how very, very large this white coat is. It makes me look extremely fat. So fortunately you can only see mostly the top of me, I think. Not exactly sure, so we should be okay. Scooch to the side there. Okay, so that's right. So the next thing, let's write down some answers to your questions. Or, yeah. So can you tell me how old you are? Hi there, Mr. Higglesworth. Today you are all one patient, so you can feel free to ask me the questions as we go, and or answer my questions, and together we will make sure that you're safe for your imaginary trip to Italy. And that's going to be how we do it. All right, so I'm going to write down, right now I'd want to get a little bit more background information since we finished this exam. Looks pretty good for the most part. We looked at your eyes, we looked at your ears, listened to your heart, your lungs, your belly, and we can repeat different portions as they come up to us. So you're 21 years old. Perfect. Can you hear that? Can you hear the sound of the paper? I love the sound of writing. All right, so 21 years old. 21 years old. All right. Any chronic medical conditions? Any hypertension? Have you been traveling elsewhere within the past 2 weeks? And have you or a relative been around anyone with a communicable disease? That'd be like a highly infectious disease, a viral disease, something like that. Can you guys hear that? Can you hear the pen and paper? All right, and then do you have any other cardiovascular issues? Any history of heart attack? Any history of stroke? Have you ever had a pulmonary embolism? That's a blood clot in your lungs. How about a blood clot somewhere else in your body? Any diabetes? How about in your family? Okay. Are you safe at home right now? Okay. Safe at home right now? Okay. Anybody, you know, do you feel in danger? Is anybody emotionally, physically harming you? These are things I always ask to make sure. You're going on this trip willingly? No one's forcing you to go? And then what areas exactly in Italy? You've had a heart murmur in the past. Okay. Do you remember what kind of heart murmur? And have you checked up with your cardiologist before you're going? Because it'd be a good idea to do a visit to your cardiologist, you know, just before you go. We can do a longer heart exam then. I didn't hear any heart murmur when I checked you just now, but sometimes certain kinds of heart murmurs only appear with certain cardiac maneuvers. So what we can do is we can have you do other maneuvers, just check and listen to how severe it is. I would also recommend then that you follow up with your cardiologist, okay? So that's good to know, heart murmur. Okay. And since you're young, it's probably a heart, you know, I would guess it's a heart murmur like hypertrophic cardiomyopathy if you're male, or if you're female, maybe something like mitral valve insufficiency. Oh, when you were initially born, you had a PFO. Yeah, you had the little heart, there was a little hole in between the two atriums of your heart. There's a little hole that, so in fetuses, the blood flows the other way. It flows what would be backwards for adult humans. And when you're born, that little flap closes when you take your first breath. The pressure of your lungs, of the air in your lungs, pushes your blood back the other way when you take that first breath. And that locks the, ooh, I'm sure that was loud, that locks that closed. And people can have, you know, pretty bad heart problems if that stays open. There's other kinds of heart murmurs that babies have, but they don't go away as you get older. Oh, that's interesting. Okay, so no, yours might have been something else, because there's other kind of heart murmurs. So usually usually they accompany a PFO. So you had a PFO, but then you had something else, is what that means. Because in order to, if they wanted to keep it patent, that meant you had something else going on, that if that closed, you wouldn't get the blood flow that you needed. There's things called the tetralogy of Fallot, is one kind of small cardiac malformation. Well, it's not a small one. And there's a number of other cardiac malformations that can essentially be worsened if the PFO doesn't stay patent. So sometimes we'll give medications to keep it open. But if you had to actually have surgery, that's interesting. that could, I mean, that could have been that you had something wrong with, maybe you had an aortic or pulmonary valve malformation. Without knowing exactly for sure and without being able to do the exam to kind of hear if it's still patent, I would really recommend that you get your old medical records and talk to your cardiologist, for sure. But if you've been cleared and you haven't had it since, it might not be that big a deal. It's just a good idea to check with your cardiologist. Obviously, expense is going to matter if you're, if it's expensive to go to a cardiologist right before travel. So then I would just rely on what your medical history has been, what your GP has said, as long as there have been no issues. It's still really good to know for the purpose of travel medicine, so that's a good thing to know. So we can do a more detailed heart exam just to listen and see if we can hear what kind it might exactly have been. So, yeah, it's always good to check up with your cardiologist. And right before you travel, if this is something you've had for a while, it's a good thing to do. So now tell me, do you ever get blue in the face when you're squatting? Because that helps me know what kind of heart murmur it is why I'm asking. And another question to consider is, have you ever suddenly passed out during exercise? And I don't mean from like exhaustion or you hadn't eaten. I mean, like, did you just randomly suddenly collapse to the ground and then find out, black out, and then find out that you had passed out, like somebody else had to pick you up? Has that ever happened? No? Okay. Has anybody in your family had a sudden unexplained death, like a sudden drowning for no reason, someone could swim and then suddenly drowned, a single car accident where it was just one person, one driver, and they just suddenly died, somebody who was young and like suddenly died in their bed, anything like that in your family history? That's significant usually for something like hypertrophic cardiomyopathy, which is the most common heart murmur in young adolescent males. Anything like that in the family? I want to make sure you can hear. No? Okay. So we can do a little extensive. That's interesting. Okay. So if they had to put in a little balloon, maybe you actually had an aortic malformation. And that's pretty rare. That's interesting. That's really, really neat. So what you could have had, that's another thing you could have had, is you could have had what's called a tricuspid aortic valve. Or sorry, that's not a thing. That's an imaginary term that I just made up. So a normal... so there are some valves in your heart that are supposed to have 3 little flaps, and in some people they only have 2. And that is what I was trying to say with don't quote me on that. That's an imaginary thing. Your tricuspid valve is a different valve. Your aortic valve is another valve. But you want to make sure your heart has all the little flaps it's supposed to have. So, all right. Hello, Suko. So you guys are all being one patient together, all of you, and you're getting ready to go to Italy. And since you're getting ready to go to Italy, we're doing your travel medicine physical exam and questions. And it turns out that you had a heart murmur when you were a child. You don't remember what kind it was. You know that as a baby you had to have a surgery basically to open some kind of valve. You had to have a little balloon in. So we're thinking that it was probably, it's not hypertrophic cardiomyopathy. We're thinking you probably didn't have a loose mitral valve. We're thinking that probably you actually didn't have the most common one, which would be a patent PFO. And so we're thinking maybe you had an aortic or pulmonary, probably an aortic valve malformation. But we're not exactly sure, so we're recommending that you follow up with your cardiologist before you travel, just to make sure that everything is in order. And then we're checking your current symptoms now, or some of the questions that I'm asking you, and then writing down in my little book here. And anyone can answer any of the questions. You guys are all one human being together today. So the next question that I would like to ask you is, do you have any frequent chest pains now, given that cardiac history? And do you have any moments, like I just kind of asked about in the past, have you had moments where you pass out completely? Have you had moments lately where you feel lightheaded, like you might pass out? And now it's different where if you stand up rapidly, you suddenly feel like you might pass out. That's called orthostatic hypotension. And that's something else, not recently. Okay, perfect. All right. And then have you had any changes in your vision where you see like bright white, like cotton wool, like spots in your vision, or they kind of look like starbursts, anything like that in your vision? And then have you had any right upper quadrant pain? That's right under your right breast. Are you currently pregnant? That you know of? The only halo effect from welding burns. Okay, that's good to know. Oh, you have an interesting job. You have an interesting job. Okay. And then have you had, I think that have you had any palpitations recently? And I don't mean ones that are associated with panic or anxiety. I mean just random palpitations. Okay, so it does sound like your murmur is actually doing really well. And like I said, I didn't hear it on the initial physical exam. So maybe we'll do a little more physical exam, because like I said, certain murmurs you can only hear with certain cardiac maneuvers. So we'll have you do those cardiac maneuvers, and then we'll continue on. So let's go ahead and do that now, and then I'll ask you a couple more questions about the rest of your review of systems. So we'll go ahead and do that right now. Let me get some new gloves, because we're going to be touching you. Gloves, gloves, gloves. I hate how sweaty I get in these. Your little face looks lovely today, by the way. Okay. Alrighty, so I already listened to the 4 areas of your heart. This time what we're going to do in order to listen is I'm going to have you lean forward a little bit, okay? So I'm just going to have you kind of lean forward. Perfect. And what we're going to do is I really want to listen to the aortic area, since that might be where the issue is. Okay, so good job. Lean forward and just breathe real normally. Great. Okay, I'm going to have you lie back at 30 degrees, okay? Perfect. Now, while you're lying back here like this, I'm going to listen again. All 4 spots. All 4 spots. All 4 spots. Perfect. Okay. Alright, while you're lying back like this, can I have you go ahead and grip your fists really hard? What happens when you grip your fists really hard is you increase afterload. So you're making your heart pump harder against the pressure that you're pushing back. And sometimes that'll make a murmur show up. And again. And again. Do forgive me. In our jungle clinic, we do have birds in the outside. They're a little bit loud. Hey Brian, can you shut the door? Can you shut the door? The birds are a little bit loud. Thank you. Okay. Alright. Sorry about that. My wonderful, lovely, and very handsome and sexy assistant has shut the door. Perfect. Alright, you can release your fists now. So the next thing that I'd like you to do is I'd like you to bear down as if you're going to the bathroom, or as if you're coughing. You know, the gentleman in you will remember that this is something that we do during hernia exams as well, down below. But this time we're just listening to your heart. Okay, perfect. Perfect. And right there. Perfect. Okay. All right, excellent. Excellent. Okay. So the next thing I'm going to have you do is I'm going to have you stand up, okay? This is going to be very difficult. All right, so go ahead and stand up, and we're going to listen to your heart standing as well. And here, and again we listen to all 4 areas. And here. Perfect. All right, so then I'm going to have you squat down, squat down, squat down, squat down. And while you're squatting down, I'm going to have you listen again. So squatting down increases afterload. Here we go. Here we go. Okay, perfect. All right, and now I'm going to have you, while you're squatting down, I'd like you to squeeze your fists. And again. And again. And again. Perfect. And then I'd also like you to try bearing down. 1, 2, 3, 4. Perfect. All right, you can sit up, get comfortable again. Get comfortable. All right. So I don't hear any murmurs. You sound excellent to me. And I think I would clear you, but I do think that you should visit your cardiologist just real quick before you go, just to make sure, because they have really, really good hearing. I mean, they've had all the extra years of education. So get these gloves off again. So when, they go through not just 3 years of internal medicine residency, but after that they go through a couple years of cardiology. So their total training after medical school is up to 7 years. A generalist like me has had well over 16 years of education. They have had, over like 20, well over 20 total education. So a lot of education. So my stethoscope is actually a cardiologist stethoscope. I have the Littman Cardiology 4, and this is the diaphragm. This is what you use to listen to especially the heart, but you use the bell as well. So when we listen both with we can switch it. You see this little hole here? So I can turn that off, and then I listen just with the diaphragm. And then here, I would listen with the bell. This helps pick up more like blood vessel sounds. So I can use this to listen to your aorta. Do you have any history of any aortic stenosis? Any kind of, specifically, has a doctor ever told you have a tear in your aortic lining or something like that? Do you ever have severe abdominal pain kind of radiating to your back? Anything like that? Okay, let me write that down. Perfect. So yeah, that's how it works. Actually, I know I just took my gloves off, but I'm going to go ahead and listen to your carotid arteries real quick. Haven't been to the doctor in a while. Well, I think it's always good to come and see me for your travel medicine checkup. I think this will be very useful. Alright, so I'm going to actually listen to your carotids. What I'm listening for is I want to hear if you have any what's called bruits, B-R-U-I-T-S. And that means that it's like brr, brr, instead of just the sustained heartbeat that I should hear in your carotids. So I'm just going to go ahead and listen. Listen right here. And listen right here. Good. And then I'd actually like to check that the pulse is even. in both of your radial arteries and in your lovely pedal arteries, your tibialis anterior, your anterior tibialis. Alright, so just going to go ahead and feel both of your radial arteries here. The reason I feel both at the same time is I want to feel that the pulse is even, that it's regular, and that it's not indifferent in both sides. And then down here in your feet, just down here. Perfect. So that can be normal. A lot of people, especially if you have very good hearing, you're able to hear your heartbeat, especially if you have heightened anxiety or any kind of PTSD type symptoms where you're really, really alert, especially if it's very quiet, you can sometimes hear your heartbeat. Now, things that concern me is if you have, a pounding headache with your heartbeat and it doesn't get better even a tiny bit with Tylenol, ibuprofen, anything like that. It's kind of frontal in a band around your head, the front and the back. And with the headache, there's visual changes like those white spots. Then we're looking kind of at a hypertension urgency. So it's always a good idea to get your blood pressure checked fairly regularly. Let me check and see what my nurse wrote down as your blood pressure. Let's see. Looks good. You have good blood pressure. Looks like you've had a pretty regular pulse, which is in tune with what I just saw. And it also looks like you have a great oxygen saturation, which makes sense with the lung exam that we just did. And your respiratory rate. Oh, your respiratory rate she put as a little bit high. Maybe we're a little anxious. Let me, I'll remeasure that, but I'll remeasure that when you're not paying attention, because did she tell you she was measuring your respiratory rate? Yeah, that's why. The patient's not supposed to know when you're measuring your respiratory rate. She's new, so, but that's okay. We'll take care of that in a bit. Your heartbeat bounces around? What do you mean by that? Do you mean like it changes, or it changes on different sides? And we have a respiratory rate. I told you it's better when you're not, when you don't know you're getting your respiratory rate measured. So that's perfect. 13, that's perfect. 12 to 20 is pretty normal for an adult. 20, we're getting a little up there, but that's okay. That does make sense. If you're really stressed, you might hear your heartbeat a lot more. In fact, that's a pretty common symptom of panic, is to get your heart beating really hard in your ears. While we're at it, I know I'm here to evaluate you for travel medicine, but while we're at it, I can actually give you a really useful panic attack handout that you might be able to use or share with other people. Let me just pull that up right here and give that to you. And you can use this to better understand panic and stress. And it's really long. It's like it's an 11, not 30. It has an 11-page little booklet for you that you can download. I got it from a psychologist that I used to work alongside. And you can go ahead and just take that download right there, and look into and that can help you a little bit with, that's a real document to help you a little bit with panic attacks. And of course, as always, I have to, confirm and affirm that while I am a real physician, I am not, this is a secret place. And in this secret place, you and I can do whatever we want to help you with your self-care. But IRL, you and I have not met, and I can't give you medical advice to diagnose or treat any illness. But of course, here in our secret little internet clinic world, our imaginary little education world, So let me go through a couple more questions. So have you had any difficulty breathing lately? And then have you had any difficulty breathing specifically when you run? Where like moving or exercising, walking at all, you don't just breathe faster, but it's hard to breathe? Do you ever have pain when you're breathing? And then when you're lying down, is it sometimes hard for you to breathe? And this is outside of panic or stress. Okay, all right. But no chest pain when you're running, or difficulty for air to get into your chest through your mouth. I was like, I'm out of shape. Okay. All right. And do you have any pain like when you try to take a breath? Does it ever feel like you can't take a breath because there's like tight things holding your breath in, or like taking a breath hurts your muscles? Okay, so just difficulty, cardiovascular demand. Okay. It sounds like it'd be good to start a regular exercise regimen. Let me give you an exercise prescription. Exercise prescription. Where is my exercise prescription? My exercise prescription. My exercise prescription. I am going to give you, what is this? Maybe it's this. And I can actually give this to you right now. Oh, this is a fitness apps handout. This is good. This is good for you. I will share this with you, but let me make it available to you. Anybody with this link can view. Here is a list of exercise apps that you can download. And then let me also show you. Now, when you say you feel like your lungs aren't expanding enough, do you feel like your throat is tight, or where do you feel like that? Can you point to the area? Do you have pain? Tell me a little bit more about this. And I'm going to show you this other, while you're telling me about that, I'm going to show you this other really cool resource. And these are real medical resources, so you should download them because not everyone is allowed to have them. So, do you have pain, or is it just like you feel tightness? Also, if you have known high blood pressure, you should take this link as well. No pain, just tightness. All right, and this is after how long running? Is this right away when it starts, or is this after a certain period of time? And do you vape or smoke? That's a very important question. I think that's my exercise prescription handout. Yes, that is my exercise prescription handout. You quit. Okay. So acid reflux, usually what you have is you have burning in your neck or in your chest when you lie down. It's not really when you're exercising, it's when you go to lie down. It's possible to have, it's rare to have adult onset asthma, but that's a possibility. Sometimes it might be that you need, you need to work on your cardiovascular fitness in general. So which is why I asked, like, how much running is this? Is this right away when you begin, when you're first exercising? Or is this after you've run, 3 miles? At what point is it that you start to have that tightness? Basically, when is that tightness is kind of the big question. So acid reflux is worse when you're lying down. It'll be like burning right in the middle, sometimes all the way up to your throat, and it's usually in the evening as well. Acid reflux also is generally accompanied by sometimes you might actually have things like burping or other things like that with it. Asthma, usually it's up here. It's like you can't breathe in. You can't get the air in no matter how hard you try. Something like a respiratory syncytial virus, it's more like the air won't go out, and instead of wheezing, you'll have this kind of other sharp sound here, in the upper airway and the upper chest. Asthma is wheezing deep in your chest. Although you can't hear that, that's something that I would hear. So usually when you're exercising, if it just feels tight, and you don't exercise more than 3 times a week, then that's you don't have any other medical comorbidities, and that probably means you need to build up to increased exercise, essentially exercise tolerance, which these documents that I gave you are pretty good for. Sometimes it's possible to have what's called costochondritis, and that's if I push on your chest here in the front. If I push on your chest, if you have pain when I push on your chest, that usually means there's inflammation along these ribs. A lot of people have that kind of chest pain. It can be pretty bad. It can be resolved with osteopathic manipulation therapy while you're getting anti-inflammatory drugs like NSAIDs, like high-dose ibuprofen, high-dose naproxen, things like that. So that's kind of a differential diagnosis. If you have something like pneumonia, then any breath that you take, and that would be including a pneumonia caused by some kind of virus or caused by a bacteria, the pneumonia will make it so when you breathe out and in, it hurts, or when you cough, it hurts. So let me do the elliptical. So the average recommendation for exercise for hypertension is in there. Pretty much the American Heart Association recommends 150 minutes of moderate intensity cardiovascular exercise a week, and that's to maintain and improve your cardiovascular health. You can split that up however you like. That can be every 20 minutes every couple of days, and that can be more sustained, but 150 minutes a week. For depression, you need to be doing a lot more aggressive exercise. So for depression, intensity is much more important than time. So if you go really hard for 7 minutes a day, like kill yourself hard, that's best for something like depression, because it gets all those endorphins going. It increases your superoxide dismutase, which incidentally also helps with aging and other things like that. So for weight loss, you're going to need to do more than 150 minutes a week. For weight loss, you should follow the Mayo Clinic guidelines, and that'll usually help. So it's really good that you quit smoking. That's excellent. So it felt like you were breathing through marbles, and you may still have some residual damage from that. So it'd be a good idea to make sure. So our lung exam today was clear, but it's a good idea to make sure you follow up with your GP or your specialist in case you still have some remaining it really is a substitute. So it really is exercising really hard, obviously not to an unhealthy level, right? There are people who put themselves in suits and exercise like 7 hours a day, don't eat anything, and actually do harm themselves. So we're not advocating self-harm, but intense exercise can actually be a great replacement for self-harm. Like when you feel like cutting yourself or something else like that, If instead you go for a really hard run, like a run where like you don't care what happens to you, you just run really hard, that actually gives you an endorphin boost similar to the endorphin boost of when you're cutting. So there is actually a lot of truth to that statement, basically. Wow, so you had a severe like pneumonia or something like that. Let me write that down. So you may have some residual damage still, and it might be a good idea just to get that checked out and see if you need to take any occasional, you know, like essentially like an albuterol or something else like that, an emergency inhaler or something like that. You should get evaluated for that if that affects your ability to exercise consistently. Like if you exercise and you feel like you're gonna pass out because you're not getting enough air, you have to be realistic with yourself, right? You have to understand, you know, like exercise is usually not going to kill you. I think a lot of times we feel like those of us who are privileged to live in certain parts of the world can sometimes feel like something is going to hurt us when it's not, especially in the case of exercise. However, in your case, since you've had that pretty significant past history, you may just want to be careful when you're exercising. You know, do 20 minutes at a time. Exercise to where you can't talk, where it's difficult to talk, but you can still kind of talk between breaths. And that's kind of where you want to go as far as your breathing. You want to be, you know, breathing hard, but you can still kind of maintain a conversation kind of with the person next to you, right? If you were having somebody next to you. So that's kind of how you want to go for that. But you should get your lungs examined really deep, the full examination, which I will show you now. We'll go ahead and do a further lung exam than the one that we just did. So what we did is we listened in the front, we listened in the top, and we listened in the back. What I'm going to do is I'm going to actually listen for, I'm going to have you make different sounds so that I can hear if there's masses, wet spots, kind of big empty emphysema type spots in your lungs. Yeah, it's normal to breathe through your mouth while you're exercising. That's super normal. And you want to, like I said, you want to go hard enough that it's difficult to talk. Less than that, if you're still able to talk pretty easily, you're not really getting a lot done. If you're going half an hour of cardiovascular activity, then remember the goal is 150 minutes a week. So right, 150 divided by 30 minutes, so you want to be doing that 5 times a week to maintain your cardiovascular fitness, basically. And then for weight loss, you want to do a little bit more than that. So maybe add a 6th day and take a day off from the elliptical. That can be, if that's a lot, what you can do is you can do a different kind of activity on that other day. Or you can change the intensity of what you do. A lot of times the best way to improve your weight loss is, instead of like doing the same thing all the time, try to work up to a bigger goal, right? Like if initially you did this many miles in half hour, try to do, you know, this many, you know, the next number of miles in half hour the next time. Basically keep building up to that goal. Let me go ahead and have you, remember I had you say 99, but I'd like you to say it in all the quadrants. So let me go ahead and have you say 99 and 99, and over here can you say 99, and over here 99. Okay, and then over here on this other side, let me have you say 99, and then 99, 99, and 99, and 99. Perfect. So what I'm looking for when I am asking you to say 99 is I'm looking for something called bronchophony. What I want to hear is it clearer or more muffled in different areas, right? You don't want it to be super crisp and clear because that means that the sound is traveling faster. It should be traveling through kind of a breathy space. If it's really breathy and open, that's kind of a sign of like emphysema, which is damage you can get like from smoking. I'm going to have you do something else as well. I'm going to listen for something called egophony. Oh, lost your ear. Let's put these on first. Okay, over here, can I have you say E? And again E. And again E. And again E. Okay. One more time, can I have you say E? Perfect. Okay, other side. Alright, so on this side, same thing. Let me have you say E. And again say E. And again say E. And again E. Again E. Alright, perfect. And of course this visit has been a little bit long. Most of the time for some of these issues I would have you make a follow-up visit and we would check on that. That way we get things done in half an hour because I know you have other things to do with your life. But since today we scheduled a special extra long visit, we have time to go through all the different things. So that's pretty nice, I think. So the next thing that I'd like to do is I'm going to have you whisper something, and we're going to look for something called whispered soliloquy. I shouldn't be able to hear what you whisper. If I do, that's weird. Okay? That means that there's something more solid or wet that's transmitting the sound through the space that it really shouldn't be. Okay? So go ahead and whisper. Okay? And again whisper. And again whisper. And again whisper. Perfect. Perfect, perfect, perfect. Okay, one more time. One more time right here. Okay. Okay, over here on this side. Let me have you whisper. And again whisper. Whisper again. Whisper again. And whisper one more time. Okay. One good whisper. Perfect. Very good. Excellent. I heard a horror story one point of a patient who went to the emergency room and the doctor said, "Yeah, your lungs sound great." And they didn't even have the stethoscope in their ears. They had it around their neck. Yeah, that's scary, huh? So, let's see, what was the next thing? Oh, so we did egophony, we did bronchophony, we did whispered soliloquy. I'm going to tap in the spaces behind your ribs and see if we can hear any kind of mass, anything like that. Okay, over here. Okay, great. And then I'm just going to put my hands under your chest right here, and I'm going to have you take a deep breath. Perfect. What I'm looking for there is even, equal rise and fall of the chest. And there's a bunch of other things that I've actually already observed about you for the physical exam without even touching you. When I look at you, I look to see, is your trachea midline? If I can see this bone here, I look and see, is it sucking in when you're breathing? I'm looking, watch, like, are you breathing through your mouth? Are you breathing through your nose? Are your nostrils flaring? I look and see, is there any blue or anything around your mouth? Are your eyes yellow in any way? You know, are you able to focus and listen to what I'm saying? You know, basically, are you awake, alert, oriented ×4? Do you clearly know what time it is, what day it is, who you are, where you are, things like that. And then if you're speaking to me, I can tell that you're not in respiratory distress. Like, that right away means that your airway is intact. If you are having respiratory difficulty, I can tell that also from the way that you're speaking. That's just stuff that I watch from looking at you. Is the rise and fall of your chest even? Abdominally, does it look like you have an obviously distended belly? That's, something that would be an issue. Like, are you gripping it? Does it look like you have obvious trauma or pain when I just look over you? Any bleeding from your head? Anything else like that? When I'm just looking, there's a whole physical exam you can do without even touching somebody. For the beginning, basically. Are you moving all of your limbs equally and evenly, or are you limping? Are you dragging something? These are all little details that we watch out for. As soon as you walk in the room, we should be thinking about all those different things. Yeah. So, Sherlock Holmes, the author of Sherlock Holmes, was a doctor, and back in that time, they really had to rely pretty aggressively on their physical exam skills. And so the reason that Arthur Conan Doyle wrote Sherlock Holmes the way he did is he was writing about deductive skills, which is what a doctor is supposed to have. A doctor is supposed to look at the details on you and from that figure out whether or not you have this or that disease, right? Like, can I tell right away if you're a smoker? Can I tell right away, who you've been around? Can I tell right away from your poses and everything else if you are safe at home? There are a lot of little details that I learned in my human trafficking and sexual assault courses. Right, little things that we just kind of look for on you. So, all right, let me write down my physical exam findings. And everything that you told me about your lung history. So basically, I think that what the first recommendation I'm going to have for you is that you follow up with your cardiologist and you follow up with your pulmonologist just to get a clean bill of health right before you go. So those are things I'm going to recommend. If you don't have time to follow up with them, then what I would recommend is you just pay very good attention to how you're feeling and your health and everything else like that. And certainly you make sure that you keep the travel medicine guidelines. So, abdominally, do you have any burning in your throat? Do you have nausea, vomiting, diarrhea? Are you having any kind of changes in color of your stool? Any black, white, bloody, greasy stool that is whitish and floats to the top of the toilet when it shouldn't? Any of that kind of stuff? And then, do you have, wow, how are you able to afford travel then? I'm kidding. Definitely make sure you talk to your local health department as well if you are having trouble getting in contact with specialists. You think you might be allergic to wheat? That's definitely a good thing to follow up with your GP on. And you can always get, basically the bottom line is if you think you're allergic to wheat, don't eat it. And if you feel better, then you feel better. Some people are just like gluten insensitive and not gluten intolerant. There is a lot of kind of alternative medicine information about gluten. So make sure that you, so you can follow up and you can get a celiac disease test. One thing that's why I ask about the bloody stool. Like, do you have inflammatory bowel syndrome, disease, inflammatory bowel disease? Do you have abdominal cramping frequently, things like that? If you don't have a regular PCM or a physician, you should definitely follow up with your local health department and see what kind of options they can assign you. If you can't afford them, then they can, give you that. Your mother has, is it Crohn's disease or is it celiac disease? Is it the one with bloody stool, or is it the one where you can't eat wheat, or you start to break out in hives and start to have a lot of abdominal cramping and arthritis and things like that? Do you know? Crohn's disease usually presents with bloody stool. So, but make sure you follow up with your health department. Even in areas like here in Texas, we have a number of free clinics as well that you can follow up with if you don't have a regular PCM. The one with the bloody stool, or the one celiac disease, the one with the arthritis. So that'll affect you a little bit while you're traveling. That means that you should probably make sure to stay away from, you should ask. You should say, hey, do I have, does this food have wheat in it? And then you just stay away from that. So basically the best thing, if you think that you're, you can actually get it's like an IgG test for celiac disease. But if you the best way to know if you can't afford the test is, because I like to do low income medicine as well. If you can't afford the test, if you can't eat wheat, if wheat makes you feel sick, then don't eat it. And that's a pretty good way to feel better. The Celiac Disease Association online has a bunch of really cool recommendations for diets and things you can cook instead of eating wheat. A lot of times people who get violently ill when you drink whey protein, same kind of thing. Don't drink or eat things that make you feel sick, basically, if it doesn't work for you. So, and that's something you can just let people know while you're traveling through Italy. All right. So we went through bloody stool, all those other kinds of things. Oh, are you having any, and when I'm talking about blood in your stool, I mean like dark red, like blood like on your stool, or like you are passing blood, versus if you have like small bright red streaks or dots, that there's a big difference in all of those. Do you have runny stool? Do you have constipation? Those kind of things are all good to know. Okay. And then do you, have any weakness, tingling, feeling like ants are crawling on you, or like kind of electricity feeling in any part of your arms, legs, fingers? Any time where your arm or leg is like drooping? Okay. Okay, perfect. Alrighty, so let us get out our yellow book. As I mentioned, this is the CDC's most updated guidelines for travel, and it helps us find exactly what kind of vaccines and everything else you need for where you're going. Before you go, kind of a good thing for you to think about, what's your, is basically your sexual activity. A lot of people, when they're traveling, they might engage in more unsafe sexual behaviors. If you are planning to have intercourse while you're traveling with somebody that's not your regular partner, you should certainly bring condoms. You should get STD tested before and afterwards. Obviously, the safest thing is not to have intercourse with anybody that you don't have a relationship with, that you don't know, because people are not always, even people in a relationship with you are not always trustworthy. So you want to protect yourself from any kind of diseases, HIV, chlamydia, so forth. You should get STD tested before and after intercourse with a new partner, because even if you use a condom, condoms are not 100% effective against chlamydia, and chlamydia in females can be asymptomatic but cause severe pelvic inflammatory disorder that can permanently affect your fertility, and that can actually give you abscesses where you can even die. So chlamydia is really easily treatable. Same kind of thing with syphilis. Syphilis is so easily treatable. It's just a shot in the buttocks. Very, very easily treatable, and left untreated, it can kill you, actually. Usually, white populations, when they experience syphilis, will die in the late stage of basically neurotoxic syphilis. Usually our black populations are going to suffer more from cardiotoxic syphilis. So basically you develop cardiac malformations. But these are after they've been left untreated for a very, very long time. Again, very easy to treat, so definitely get tested before and after intercourse with a new partner. The best recommendation I can give you is kind of get to know somebody before you have intercourse with them, because that kind of gives you a higher level of trustworthiness. Avoid intercourse with multiple partners, because you really should get tested between partners. So while you are traveling, because again, there are a lot more at-risk behaviors sometimes while traveling. That's actually how HIV spread. The fastest part of its spread was related to a flight attendant initially, early on, who was traveling and sharing a little bit too much. So you want to get tested before and after, so that you can keep yourself and keep other people safe. Another good thing to do is check the expiration dates on the condoms that you bring. If you are a lesbian, you should always have dental dams with you, and I can teach you how to use those if that's something that you need to know. For your safety while you're traveling against unwanted sexual contact, try to always go places with a partner, with somebody with you, a battle buddy essentially. Have somebody watch your drink. Never leave your drink unattended, but have your trustworthy person be with you, be with your drink, and look out for each other. And that counts for males or females. The incidence of male sexual assault is higher than you might imagine, and obviously we all know that 1 in 4 females are sexually assaulted. Most of the time it's going to be by somebody you know. Date rape is the most common. So, even if you're getting to know somebody while you're traveling and you feel like you like them, it's been a couple weeks, still exercise basic precautions. It's always good to make sure that you establish curfews for yourself so that you're in bed before you get too drunk, for example. It'd be nice to live in a world where we could all get as drunk as we like and no one would harm us, but unfortunately it's not the world we live in. On the other hand, it's not your fault if anything happens. So if anything does happen, contact local authorities immediately and get a sexual assault forensic exam within the first 5 days. Don't throw away your underwear. You're going to feel like you want to. Save your underwear, save everything else that you have on you, because that can be used for DNA evidence. And even if you were drunk or you feel like they're going to say that it was consensual, still you can get the exam. And if you don't want to get the forensic exam, still seek medical care, because you still need your STD test, you still need pregnancy prevention, you need everything else like that to help keep you safe. So I know those are kind of uncomfortable things, but they'll keep you safe. And of course, while you're traveling, never engage in sex with somebody under 18 years old. Child pornography, trafficking activities in any country. Some gentlemen like to travel to East Asia because there is a laxer prostitution environment, especially in Thailand and in certain other areas of Southeast Asia. It's supposed to be a good time. However, you never know if the prostitute you are engaging with is actually a slave. And in East Asia, human trafficking is at an insane high right now. And remember that they're actresses. It's on their life to make you think that they enjoy it. So even, you thinking that they enjoy it or thinking that they want it isn't enough evidence to really protect you and make sure that it's a consensual encounter. There are a lot of cases of young mothers being held by human trafficking rings, and they have to prove that they enjoy it or their children will be harmed. Or people who are in significant poverty have to, prove and act like they enjoy it, or they're, either physically going to be harmed or they're going to starve. So definitely be, I know a lot of people travel, especially a lot of single men travel for fun and to meet partners, but while you're doing that, keep yourself and other people safe. Like I said, regular STD testing, lots of condoms, making sure that you are, trying to have, stick with one partner, and don't engage with prostitution, because it could be human trafficking. There are places where there's supposed to be places where prostitution is legal, like Holland. The theory is that there's less trafficking, but in reality, what happens is when you have the legal prostitution, they've done studies that have found that then they make the back of the house into the child trafficking part, because they have the legal front for the adult prostitution, where the women do have more control over their situation, but in order to make more money, one of the pulls for prostitution for a lot of Johns is that they can do something that they're not allowed to do. It's some of the risque part of it, and so that's why people will say like, hey, I have the good stuff in the back, I have a 14-year-old or something like that. So even by supporting a legal prostitution ring, you may be supporting the backdoor trafficking as well. So just stay away from all that. Find your partner through safe means, get to know them, and always get yourself STD tested as much as you can. And when you come home, if you've had, and again, this is no judgment, things happen. Sometimes people end up having multiple partners. And so when you get home, just make sure that you get STD tested. on your way home. Yes, this is live, Crackle. So what we're doing is we're doing a travel medicine exam, and what we've done is we've listened to your heart and lungs in great depth. We've examined your eyes, we've examined your ears, we've gone over your past medical history, and we're getting ready for your travel to Italy. And so as you're getting ready for Italy, we're taking some of the CDC Yellow Book guidelines to try to help you out. And Crackle and anyone else who's here new, I am an actual physician, and so we're kind of playing in the chat. You're asking your questions, but nothing that I say can be official medical advice to diagnose or treat any disease that you have, because you and I have never met in real life. But here in this wonderful imaginary place, we can do self-care and education all day long, and we can learn all these kind of things. No, I happen to have birds. So within the context of the role play, this is my jungle clinic, and out there is my jungle. So absolutely, but it's not my place. Oh, my donation link is in the bottom under here. My donation link is below under, if you just scroll down the page that you're looking at, how to donate for real. But it's good to see you. So my job as a physician is to help you out but not judge you, while still giving you the information and the recommendations, and all the information that I just gave you. I really stand by. It's medically solid. I'm in real life sexual assault medical forensic examiner. Also, I pioneered the human trafficking course at the Ponce School of Medicine in Puerto Rico. Pioneered bringing that to medical students. And human trafficking and all these other things are things that I have a lot of education in. There's obviously a debate about some aspects of this. I'm always willing to present more evidence or things like that. Yeah, it's just while you're traveling, it's best to avoid intercourse, with more than one person, and it's a good idea to make sure you STD test before and after every encounter, just to keep yourself safe, because you are valuable, and your long-term health is valuable, and you are a special and important person, and you also are too valuable to be harming other people as well. So that's a good thing. And of course, engaging with a child is never a good idea, no matter what the laws are of the place you are. That's just don't do that. That's bad. And if you have significant mental health issues to where that seems normal to you, you really do need to go seek help, and you can find help. There's plenty of free health resources actually for people with those kinds of disorders. So yeah, you can ask me any career questions that you like while I look up and find your Italy situation. Oh, one thing that I didn't ask is what is your medication history. Let's write down your medication history. Yep, I agree. Oh, how long did it take me to get to the job that I'm at now? Give me a second to write down all your medication history, and then I'm gonna cry. You hear that lovely sound? Ritalin, nothing else. Okay. So, that's perfect. Any herbs or anything else like that? And do you need an additional, 30-day supply, 90-day supply on your way out? Yeah? Okay, I can write and refill that for you so you can get a travel supply. When I do deployment medicine with my military population, we always write for a big supply right before you go. Alright, so I'll write you an extended prescription. Do you know what strength that you are taking? And sertraline. Okay. Oof. Okay. Alright, so you're not taking it. Okay. I don't need to, I won't refill anything that you're not taking. Ritalin is often best used in younger children. Older folks who have ADHD often do better with something like Concerta or Strattera. to tell you the truth. But that's something that we can definitely, you should talk to your local health department about getting yourself a behavioral health specialist. So I did, you know, the 12 years of normal school education everybody does. Then I did college, and then I did 4 years of medical school. And then after that, I did 2 years of internship and residency training. Then I left because I decided I didn't want to specialize in that. I did operational medicine for about 1.5 years. So I'm a fairly young physician. I've been in practice for about 4 years. Yeah, 4 years after medical school, because I was in practice 1, 2, 3, 4. Yeah, about 4 years. Fairly young physician. The benefit to that is I've been working on my fellowship of advanced wilderness medicine. I was qualified as a sexual assault medical forensic examiner, and all those extra things are kind of fresh and new, which means that I can do them. So yeah, that's the story. So the average specialist has about 3 or 4. I'm a generalist. The average specialist has about 3 or 4 more years on me. The average family medicine doctor only has 1 more year on me because, like I said, I left that specialty. I didn't want to specialize in that. I had some ideological differences with how things were being done with the ACGME, and specifically at that military residency. So that would be 1 year, and then most internal medicine docs, it's about the same. So actually, no, it's not that much that most specialists have. Most specialists just have 1 more year on me. The very high level specialists, like a cardiologist, they have like 4 or 5 years on me. So their total years of education after high school is almost 16 years, because 4 and 4, yeah, like 16 years of education after high school. So wow, you're taking, okay, dicyclomine for the IBS and ondansetron for the nausea. Let me just write these down and I can get them refilled for you. And that'll help us. All right, let me pull up here the information for Italy. Another thing that you should think about, are you bringing any animals across the border? Okay. Becoming a medical assistant, I am going to be posting a lot of interesting medical education stuff you can use. When you're becoming a medical assistant, probably you can probably do it in under 1 year or 2. It's a really good option. Being a PA just takes college pretty much, and they have a lot of abilities. You're going to bring the pet skunk? Perfect. All right, let me pull up for you. So I'm going to give you the USDA website. Basically, there are some pretty strict requirements regarding anything that can be considered, I guess in colloquial terms, vermin. It's not actually as strict as birds, though. Birds are really difficult, but what you want to do, and I'll write down for you here, is the USDA website. And I'll give you this sheet once we're done so that you can use it for your health. The website you're looking for is the USDA APHIS website, APHIS. I know this because I travel with birds frequently. I took our birds to Korea and back, and then they had to be quarantined for a month. It was not cheap. So definitely you're going to want to factor that into your costs. So another thing to consider is making sure they get a vet check before they go, which is going to be required by the USDA anyway. What you're going to want to do is check both the requirements of the country you're going to and the country that you're leaving. Here, I'll show you the USDA website for it, and basically what you can do. Now, they will sometimes define pets with limited ways. In Japan, skunks are a widely recognized pet. Not going to be an issue at all. For Italy, let me pull up the requirements here. So Italy is fantastic because Italy allows USDA veterinarians to make the call as you're going in and out and make it online. You can do an electronic signature, so that's great. And they have options for kind of unusual animals, and you can get an international health certificate. So you're actually in a good place. The European Union basically has the same pet requirements for pretty much the entire place. So that's going to be good for you. And then, of course, there's additional requirements you'll see at that bottom of the page for returning to the United States with your pet. You asked about connecting flights. Connecting flights aren't going to be a problem as long as you're not leaving the airport. Sometimes some countries will want to inspect your luggage as you're coming in and out of the country. I've had that happen when I was in South America, even though it was a connecting flight. But for the most part, as long as you're staying in the airport, it's not a problem. So just make sure you have all your paperwork on you at all times. It would be the #1 requirement that I would have for you. And there's also, if you're planning on importing an animal, there's a number of phone numbers that I can give you that can help you out as well. So, but let's pull up the requirements for Italy so we can get your vaccines and your tests scheduled as you need them. Italy, IG, IN, Iran, Iraq, Italy, 75 and 475. So here we go. Here is our, oh, this is wrong. It's not 75. Oh yeah, it is. Will you be visiting the Vatican City while you're there? Okay, so let's see. Let me write down your requirements here. So you don't need any yellow fever or malaria vaccination. Malaria isn't vaccination. Malaria I would give you, depending on your health status, either something like doxycycline to take regularly. That's the cheapest one, so I also look at your financial status. If you're pregnant, you can't take doxycycline. So stuff like that. But you did tell me you're not pregnant, so that's good. Yellow fever, no vaccination requirements. So that's good. And let's see, 475. 475. Let's see what other requirements there are at this time. 475. Now, while you're traveling right now, and this is something that you're going to need to check. Oh, this is silly. This is dumb. This is stupid the way they have this page laid out. This is very stupid. Okay, well, while you're traveling, there are some countries that are going to require that you have proof of vaccination for the current health concern worldwide, and there's going to be other countries that require that you have proof of a negative test within the 14 days prior with no contact with anybody else. So those are both things that you're going to need to do. So while you're getting your vaccine, if you have a lot of DVTs, you shouldn't get the Johnson & Johnson version because that was found to increase DVTs. Otherwise, the current recommendation for the Pfizer or Moderna, the mRNA shots, is pretty much everybody should get them. So your doctor did not give you the wrong stuff. Your doctor thinks you have IBS, not IBD. Your doctor thinks that you have stomach pain that's related to cramping. Dicyclomine is fantastic to help get rid of cramping, and ondansetron is great for nausea. If it's for long term, then your doctor probably thinks you have IBS, which is where your gut is kind of depressed and has stomach cramps. If it's and that's not IBD. IBD is different. Inflammatory bowel disease means that your immune system is attacking your gut lining and you're having bloody stool, you're having ulcers, you're having severe pain, and I'm talking like not just like a little, bright red from hemorrhoid. I'm talking about like you're pooing blood, which is not very pleasant at all. That's IBD. IBS is actually caused by a lack of the correct neurotransmitters in your gut. It's kind of like your gut is depressed. So sometimes antidepressants will actually help IBS. IBS is like you gradually, like your gut isn't getting enough of the right neurotransmitters to activate the nervous system of your gut properly, and so it activates when it shouldn't. And it does silly, stupid gut things that it shouldn't do. Excuse me. I see that you're fidgeting a little bit because you're uncomfortable. Let me just check your little face right there. There we go. Perfect. Is that more comfortable? So you're all covered. It depends very much on your health. I cannot, that's a pretty controversial health topic right now, and so I can't give you guidance outside of the very specific one I just gave, which is if you have DVTs, you shouldn't get the Johnson & Johnson. If you are, and I think it's actually straight up been paused and recalled. If you don't have a history of DVTs, lung clots and things like that, then I think you really should evaluate with your individual physician. The issue is that the current basically COVID-19 tends to dramatically increase your risk of something like a DVT, of something like a PE, even of something like a stroke. Obesity is a significant risk factor, so even if you're a young person, and obese, you can die. However, the survival rate is normally very high. For the average healthy population, you're looking at like 1.5% death rate, if that. So it's kind of a, yes, I live near base, and so there's a lot of things that go on. There is a drug street just a little bit away. And then of course there's always things going on with the ambulance and other kinds of things like that. I can actually hear reveille and the explosions at night, the tank artillery and stuff like that when I'm going to sleep. So I do not recommend voluntarily getting any kind of disease. Obviously, as a physician, I would be very opposed to that. So really you should follow the recommendation of your local physician. There are some concerns that I completely understand, especially on page 46 and 48 of the FDA document for the Moderna and the Pfizer vaccines. I would just not get the Johnson & Johnson. I would consider the Pfizer is what I would consider. If you are perfectly healthy and you have no risk of anything else, you 100% should get the vaccine, because you don't want to spread it. You don't want to be spreading. You don't want to have a lot of disease later on. If you have severe asthma, if you're very, very old, please get the vaccine, right? The only concerns that I have regarding the vaccine are people like, I have somebody right now who has an increased risk of getting DVTs, and I'm uncertain if I feel comfortable with them getting any of the vaccines. But on the other hand, COVID also increases your risk of DVTs. So you really gotta dig into it yourself. You really, really, really should. Really do your homework. So a DVT is where you get a clot in your leg. Or that can break free and then go up to your lung and kill you. That's no fun. Nobody likes that. You would know if you had had a DVT. Which is another thing. It does, that's true. That's another thing that we need to talk about for your travel. So, how many connecting flights do you have? Let me write this down. How many connecting flights do you have? Okay. So, you need to get up every couple hours on your long flight so that you don't get a DVT. Basically, you don't want a blood clot in your leg that could kill you, especially if you're overweight. If you're overweight, you for sure don't want to. You have so many connecting flights. Either way, you have many. In that case, you probably won't have to get up very much. So with all those connecting flights, regardless of the exact number between 7 and 24, I see that you are feeling a little bit dissociative today. With all your connecting flights, I guess your flights are going to be fairly short. So as you get up and walk around, just make sure, you just get up after every place. If you have a long flight, every couple hours, you should get up, you should take a stroll around the cabin. And while you're sitting, you should try to stretch out your legs, bend them again, give them a little jiggle, just kind of move your legs as much as you can, okay? Got to make sure to be careful and not get a clot. So let's see. So we don't need those vaccines for your Italy travel. I'm a little bit annoyed that this book didn't list things appropriately. By the way, Italy has a 6.1 per 100,000 crash death rate when you're driving, which is not that high, but make sure that you understand. Are you planning on driving at all? Because your license actually will work internationally often for driving, depending on the country. Okay. Just make sure that you're comfortable. Perfect. That is exactly correct. Athletes have slower resting heart rates. 100% true. So, our earlier cardiovascular exam was great, and your pulse was great, but if you have any of those symptoms that I talked about, palpitations, passing out, like where you black out and you don't know what happened, feeling like you're gonna pass out for no reason, not because you've been, like deprived of waters or foods or things like that, not because it's very hot, just for no reason whatsoever, feeling like where you get those headaches, where you get those white cotton mouth, cotton spots or splotches or like starbursts in your vision while you have severe headaches that are a band around your head, chest pain that gets worse when you're walking, chest pain that like where you can't breathe when you lie down, chest pain that stops hurting as soon as you stop walking and starts hurting as soon as you walk, right? Those are all concerning, and you should check out your cardiovascular. All right, good night, Suko personality. We have a traveling person with dissociative identity disorder. I love it. I love it. I love the inclusion. Have a lovely, lovely, lovely sleep, Suko personality. Have a good day at work tomorrow if you're working tomorrow. If you're having a Sabbath, have a wonderful Sabbath. Italy, that is it. All right, so yeah, so driving safely, just make sure that you're checking that. So that is it for your are you going to be traveling to any mountains or anything like that? If you're going to be going to mountains, have you been practicing and prepping? So like, are you going to be going to the Italian Alps? Okay, so in that case, have you been doing any kind of altitude training for your any kind of altitude training? Oh, I see. That's why so many connecting flights. So if you haven't been doing altitude training, and you haven't been doing like a hypobaric chamber or something like that, I'm gonna recommend that you take some acetazolamide with you to help prevent HAPE. What are HACE and HAPE? So HACE is high altitude cerebral edema, and that's where because of changes in pressure as you go up, you get a bunch of fluid on your brain, and you shouldn't have fluids in your brains. That's not a good thing. HAPE, high altitude pulmonary edema, is also not good. You get a bunch of fluid in your lungs. Fluid doesn't belong in your lungs. Air belongs in your lungs, silly. So those kind of things. You can also just get acute mountain sickness, which you just will feel out of breath, nauseous, maybe a little bit altered and confused, but not too altered. So those kind of things. So for either of those, I think we're going to give you a prescription of acetazolamide just to take with you, depending how high are you planning on climbing. Yeah, we'll give you a prescription of acetazolamide. Acetazolamide. You're not taking topiramate for your headaches, are you? Okay, good. And you're not taking cyclosporin, tacrolimus, anything else like that? Okay. If you take metformin or diclofenac or acetaminophen, don't take them within half an hour of taking acetazolamide, okay? You're going high. Okay. And let's see. When you're eating, remember to please eat just things. So this is going to 100% be up to you and your risks, but you got to understand you are at significantly increased risk if you eat something that has the peel or that doesn't have a peel, right? Like an apple or something like that, something that doesn't have a peel. Even if it's washed, the water may not be to your gut bacteria. I think it's a great idea to bring a probiotic with you, like you mentioned, a probiotic and maybe even a prebiotic to help you out. That's totally a great idea. But just make sure that you are eating food with peels, basically, is the best thing. Good idea to stay away from lettuces and things like that. Things that you can't control the outside of, right? However, I understand, hey, I'm an adventurous eater when I travel too. I will sometimes take the risk of a traveler's diarrhea over something else. Just make sure that you're watching your symptoms. I understand if you decide to make riskier food choices. I just recommend against them, right? Eat things that have the peel on them. Drink bottled water if at all possible. Kind of things like that, okay? The macaroni with the gravy. Yeah, things that are very cooked, things that are very safe. At the same time, I want you to have fun and explore your food options, right, while you're traveling. Let's see. Now, you don't need any of these other things. How about your other vaccines? Are your other vaccines up to date? Oh, you brought your vaccine schedule with you. Let me see that. Okay, so it looks like you have your hepatitis, you have your MMR, it's hepatitis B. Now you can consider getting hepatitis A when you travel, especially if you're planning on eating like raw oysters and things like that. Hepatitis A, as opposed to B and C, which usually come from like drug or blood interactions. And I do recommend you not do intravenous drugs while you're traveling. Again, no judgment, it's just really bad for you. Just don't, it's just not a good idea. And same with cocaine. Burning a hole in your septum is not super fun. Cocaine is one of the leading causes of heart attacks in young people because it can also burn a hole through your heart. So I would recommend not to do those things, but especially don't do the intravenous ones while you're traveling because you don't know where everything has been. And if you do struggle with use of kind of unapproved substances, then I would highly recommend you go ahead and your local health department actually may even have free courses that can help you out, help you to get out of that, because there is a lot of public health interest in that. So your as far as traveling, some people travel in order to get like depending on the state you live in, right? In order to get marijuana for their headaches, their PTSD, other things like that, just make sure that wherever you come back to, understand that your hair can be tested for weeks afterwards. And so for your legal safety, just be aware of that. Be aware that you can still have traces of things. So if you live in an area where that might penalize you for trying to get those kind of things for your health, I don't think that's fair. But just so that you're safe, I would recommend knowing that it can be in your hair for several weeks. So maybe avoid it if you're going to come back to an area that's going to try to get you on that, or just don't live in that state because that's a dumb state. Excuse me, I apologize. I didn't say that. And if you're in the military, obviously no marijuana for you. Don't do it. Don't try to do it. You ruin your entire life, and it's gonna be a problem. So there is no such thing as a señora doctor, because it's just doctor. It's doctora. Señora means Mrs. Okay, so MMR, you can get your hepatitis A if you like, to prevent having nausea and vomiting. Hepatitis A comes from food, so does E. Hepatitis E can come from seafood and things like that. Claro que podemos hablar español si quieres, pero en Italia no vas a querer hablar español, vas a querer hablar italiano, obviamente. Siempre me hace feliz cuando alguien me habla aquí en español, porque extraño mucho a donde hice mi escuela de medicina, cuál era Puerto Rico. ¿Dónde aprendiste tu español? ¿Y estás estudiando italiano? Oh. So, yes, you mentioned you get your influenza vaccine every year, so you've got that. Now, rabies vaccine, that's a great question. Rabies vaccine is very uncomfortable and painful. If you're going to be caving a lot with bats and things like that, you could consider it. But the bigger thing to think about if you're going caving is things like histoplasmosis, things like other different cave fungi. So make sure you know that you have the appropriate breathing apparatus if necessary. Just watch yourself. If in the couple days following you find that you're having difficulty breathing, seek medical attention so that you can get those funguses taken care of, right? Let's see. I think that might be everything. Special conditions, you're not pregnant, you're not breastfeeding, right? Disability, handicapped, we've talked about that. We looked at your routine vaccines and your travel vaccines. We talked about your altitude. We've covered a lot of things. Your itinerary, your time, your reason for travel. Are you adopting any children while you travel? You are. How many children are you adopting? Congratulations. That's fantastic. And you're going to meet him in Italy. I love it. I love it so much. Independent travel, propensity for adventurous eating, traveler risk tolerance, general hygiene standards, modes of transportation. We talked about that. We talked about car accident risk. You're not doing disaster relief, but you are adopting. So since you are adopting, you're going to want to make sure also that the child has their medical exams before and after traveling so that you don't have any problems coming into the country. I'm sure that you have your paperwork well in order. And then like we talked about sexual activity, I should mention your HPV vaccine, right? They've now extended it so males and females can get it after the age of 26. If you have ever been active with more than one person, ever, then you should get it. If you're male and you plan to be active with a female and you've ever been active in the past, you should get it. The HPV vaccine prevents cervical cancer, and for men who have sex with men, it also prevents anal cancer. So very, very good to get the HPV vaccine, very important. The only people who don't need the HPV vaccine, and people would even say that they do, I say I'm a little more lax with vaccination. The only people who have an excuse to not get it are people who have never had sex with anybody except for one partner, and they're going to be with that partner forever. Sexual assault is still a possibility, right? And people who assault people don't always have safe sex practices. So even in that case, that person needs to be aware. Would be a good idea to get the HPV vaccine. I will just come out and say I don't have the HPV vaccine. I have one partner who didn't have any other partners as well, because that's the other thing. If your partner had any other partners or is going to have any other partners or ever has had any other partners, you should get the HPV vaccine. So 99.999% of the population should have the HPV vaccine. And that includes, children starting at age 12, because sexual assault is a thing. And you want to protect you want to protect people from cervical cancer that they didn't ask for, right? Especially. Yeah, it's yucky. HPV vaccine. So make sure that you get your HPV vaccine. That's HPV, and it's just 3 doses, a 3-dose series, and then you're protected for life. Basically, it's really, really good stuff. So again, if you've ever had intercourse with someone who's had intercourse with someone else, or if you yourself have ever had intercourse with more than one partner in your lifetime, or if you ever might be sexually assaulted, so pretty much everybody should get the HPV vaccine, okay? Definitely, that's the recommendation. Talked about influenza. Make sure you get your meningitis vaccine. I don't see that here on your records. So all soldiers have it. So you want to make sure you have that. And the Kingdom of Saudi Arabia requires it in case you're stopping over there. Your pneumococcal vaccines, your polio vaccine looks up to date here. Looks like your DPT is just about to expire. Remember that you need a booster every 10 years. So I'm going to write here for your DPT, for your little booster. So there are concerns. So it's true, but that's in children. That's in children usually. And that was with the old version of the DPT vaccine. So you're not going to die over there. You just got to get your vaccines. These are standard vaccines for everybody before they travel. Well, Schoolie JB, there is a reason that I have a 100% patient approval rating with both my ICE and my JOES scores. And there's also a reason that other physicians hate me, and I do not have good approval rating or ratings from other physicians and supervisors. My patients love me, and then the other doctors do not. And there's a reason for both of those things, and they are the same reason. They are the same reason. All right, so your varicella vaccine, you're not old enough to really need a zoster vaccine. You're 21, as you said earlier. That's going to be when you're 65. Cholera, hepatitis A, we've talked about. Since your little one is coming from Haiti, on his way back, you want to make sure his cholera vaccine is up to date, okay? Because that's a significant risk there, okay? Japanese encephalitis is not endemic to Italy. I don't think that you need to get that. We just need to make sure that your, travel plans are good. And tick-borne encephalitis, typhoid, yellow fever. You don't need these things. Make sure you take precautions to prevent things like so I will be starting a telehealth general practice eventually, actually, where I do talk about things like travel medicine. So it's going to depend on where you're located. That's going to be for the places. Right now I'm licensed in Virginia. I'm transferring to get an additional license in Texas and Florida so that I can try to cover more people. So if you're in one of those areas, or if you're in a state that has telehealth, that has like telehealth agreements, let me know. So email me and we can talk about that. I do scaled pricing so that you're not getting like screwed by insurance. I actually do direct pricing, so like people who can't afford medical care, it's a little cheaper and so forth. So you can email me. You're in Miami. Ooh, that's awesome. Miami is cool. So you can actually email me at my business email on my YouTube, depending on where you're located. And we can talk about it, or we can talk about finding you somebody. And like I said, because I think that insurance is really corrupt with how they're screwing people over, I do my own, I do what's called direct patient care, which is a completely different model that kind of bypasses all of that. In some models of direct patient care, you pay like a crazy low flat fee every month, and then you get unlimited care, and you don't have to worry about co-pays, you don't have to worry about all those other kinds of things. And I'm open to like adjusting things to what people need. which I think is what sucks about a lot of the way insurance companies work, is they're not interested in that. So yeah, $200 a visit is crazy. It's crazy. I agree. So, but yeah, actually I do plan on doing a fan meetup in Florida, and you know, at some point, and actually one in Virginia as well. I know there are people in the group who also are located in Virginia. So that's something that I actually want to do. I want to do like an ASMR group at some point, and do kind of a little, you know, little thing, which I think could be fun. So email me about these things, or I'm going to make announcements when they come out, and I'll let you know. If you're interested in doing telehealth with me, I do have it set up to where we're getting, you know, the confidential HIPAA patient records, figuring out how to make sure we can get you labs, medications, things like that. It just depends on where you're located, and I understand if maybe in a public forum you don't want to say where you're located, and we can look and see. So Discord is not a safe place to do telehealth because they don't have HIPAA compliance. So it's with a very particular, I have to get things set up still. I'm working on it, but there is a particular software that we can use to make sure that we're compliant. If you mean Discord just for ASMR, yes, actually, there is a Discord for channel members, but it's not frequently used at all. Where channel members are most active to talk to and to talk to me is actually straight up in the community tab on YouTube, or here in this chat. I'm actually going to create a whole new little social media network just for us, like all of our community, anyone who's like subscribed on YouTube. And yeah, I really like Discord a lot. I actually think it's really cool, and I'm trying to create, I'm working on it. It's taking me a long time, because I have to figure out how to set up the groups that I want to set up for in the social media network. I actually have the network already up. I just have to, and I just have to figure out how I'm going to introduce it to you guys, and it's going to be like a little treasure hunt to find it. Anybody can get in, but you have to find the password, and I'm going to hide the password in the comment sections with some of you guys who comment most frequently. It's going to be fun. So I do have a Discord for the YouTube channel, but it's a members only Discord. I actually have 3, but the new like social media community is going to be for everybody, and it's going to be super awesome. I think a lot of the people in the community, in my community, for whatever reason, don't use Discord and don't like to talk to each other, probably because they all have social anxiety and depression. So, which is why I want to set up a community where it helps you to talk to each other more easily, and makes the connections for you. Actually, we're going to set up like a little kind of almost like pen pal system, and that's the thing that's taking me a little while to set up, to figure out how we can do that safely and comfortably and deal with in a way that works with everyone's social anxiety, and keeps everyone safe. But yeah, I love Discord. I think it's a super cool, super awesome and really cool kind of software. So let's see, we talked about altitude illness, we talked about traveler's diarrhea. You can take loperamide with you. You want me to write you some loperamide that you can take in case you have diarrhea? So most of the time the best treatment for diarrhea is to let it continue, let it pass, let it get out, poop the bacteria out. You don't usually want to take antibiotics. However, loperamide is not an antibiotic, but it can stop you up so that you can continue doing what you're doing and have your life. So when you're too much of a dork to send out personal info. Yeah, exactly. It wouldn't be like address and things like that. It would be literally, I want to set up a safe server where people can talk to each other through this social media channel without sharing any personal information, and where everyone uses aliases as well. I want everyone to have their own special name, like your superhero name, kind of, it's dorky and silly. Kind of like on Discord, right? Same kind of thing. Discord is wonderful, and I really like it. I just wanted to create something that was kind of like a Facebook, but a Facebook for us. That's not a dumb Facebook, and something that's not controlled, and also something that no one can cancel me on. You can be Batman. Absolutely. Because that's the other thing is, I'm fully aware that at some point it's possible that, you know, I could get in trouble with YouTube or something like that, which is why I give you guys the option to get on my relaxation club list and my superhero list, because eventually, you know, I might disappear, and it would be nice to still be able to send you cool stuff and make you videos and do neat stuff for you, in which case we would need to do it on a different platform. So I'm so sorry. My husband is trying to get Mango to shut the F up, but she has some Wait, what do you mean by that? Lovely endorsement packed in Captain Obvious rhetoric. No, not a sub. I'm not talking about a sub. I'm talking about because on YouTube, the subscriptions, like, while they're appreciated, they won't, they may not stay, right? YouTube may make it all go away. Because YouTube does not care about creators. That's your quiet announcement. I mean like the lists for the superhero and sci-fi, or for the relaxation club, are so that, like, I don't lose you guys. Basically, my goal is to collect as many of you guys as possible, so that no matter what happens, I can still make stuff for you. That's my goal. Aspie friendly way of staying connected. Although I certainly appreciate subs on YouTube, on Twitch, or whatever as well. I appreciate whatever works for you. But yeah, I do have a direct donation link down there. And thank you, Schooly JB. I appreciate it every time that you every time you're on the stream. I appreciate that very much. So yeah, I think that it's important to be aware that yeah, and your personal, that's true. Yeah, I see what you're saying. I absolutely see what you're saying. So, and I think it's really important to be like, you know, like you said, Aspie friendly. And I don't make things super, I don't have the time to be so personal all the time. So I tend to be very Aspie friendly. Like, I will write things or say things that are pretty intimate, but then when it comes to like direct one-on-one contact, I sometimes have to, you know, like, back off, because, you know, gets overwhelming also. So that's why I do really well in things like very structured patient encounters or things like this. It can be a little bit challenging for me to do a lot of one-on-one contacts, which is another reason that this works really well. Like YouTube, Twitch, the email list basically works really well, because I can give you like love and care without kind of compromising my own safety and mental health, and without kind of promising you things that I can't deliver. Basically, it's very important to me. Like I get a little worried when people I get a little bit worried about like terms like friend or other stuff like that, because I worry that like I'm 100% gonna let somebody down who you know, in that kind of situation, because I you know, like I have like chronic pain that changes everything I do in my life, and so my life is very unscheduled and odd, and so I can be I don't want to say unpredictable, but I don't, it's very important to me not to promise things I can't deliver, because I've been in that situation where people promised me things they couldn't deliver, and I wish they hadn't. I wish they hadn't said, oh, I'm gonna be your best friend and all these other things. I don't like that. So what I try to do is I try to deliver care that really helps you have self-care and gives you power, and I'm hoping that with the new social media thing we can connect everybody, and that'll be good. So yeah, I want you to have power, and then hopefully we can help you guys make those connections with each other as well, and form some of those like legit friendships that you can strengthen. I don't know why this is connection. This is beep 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 beep. That's connection, I guess. All right, so travelers, diarrhea, bloodborne pathogens. Yep. So I think that's good. I think we've gotten most of our concerns. Oh, I think that it's a good idea to bring with you some ginger and peroxidine. Some vitamin B6 and ginger both can help you with nausea while you're traveling as well. I think both of those things will help you. And I think that we might be at our happy. We might have gotten everything. We talked about DVTs already. A lot of this stuff we talked about without even me pulling up the book. That makes me happy. Makes me very glad. Yellow fever, malaria, we already talked about that. Food and water precautions, we talked about. Don't swim near storm drains, okay? Don't swim in sewage, human, animal feces and things like that. Don't do that. That's not a good idea. Yep, don't swim in that. And bring mosquito repellent and tick repellent. Bring both of those things. You could use DEET, picaridin, those kind of things. Make sure that you bring stuff for sun protection, okay? That's important. If you're going to a place that has bad air quality, you can check your air quality index. Let me show you where you can check, because while you're traveling. So airnow.gov is the website that you can check your air quality, and if it raises, the thing will let you know, it'll be like yellow or red. If it raises, then you need to put a you need to wear a respirator, which you're going to be wearing masks anyway most of the places you travel. So mold, radiation, animal bites. Avoid monkeys because they carry herpes B virus, and that is fatal. Doesn't have very good treatment. We talked about bats. Dogs and cats are a problem. Make sure that you just get treated and get antibiotics for them quickly. Don't eat uncooked or undercooked poultry. Okay. Stings and envenomations, I don't think we have to worry about since you're going to the mountains. Next time we can talk about if you're going to the sea. We talked about cholera, we talked about histoplasmosis. I think that we have got everything for your trip to, I think we have everything we need for your trip to Italy. And use those damn monkeys. Toxoplasmosis, yellow fever, we talked about pretty much everything. I'm pleased. I am happy. It is frustrating that, oh, here we go. Okay, this is what I was looking for. I wanted to find one more section. There is a section that I just wanted to check real quick before I let you go on your way. And I just want to make sure, since we're talking about Italy, popular itineraries, that's Asia. What? They don't care about Europe, I guess. They don't have a section in here for Europe. That's so dumb. Alright, well then we got everything. We got everything that they have for us. That's silly. There you go. There are monkeys in Italy, but not just hanging out in the wild. They are in zoos. So if you are taking your adopted Haitian son to the zoo, don't let him get in with the monkeys, which is a lesson that we should all have learned from a certain gorilla a while ago. Not to go all meme lord on you, but we should take our precautions when it comes to those things. So I think that's it. I'm going to let you go since we've finished our visit. Thank you so very much for choosing me for your travel medicine your travel medicine experience. So my knees are starting to be on fire, so I'm going to have to go. But I hope you guys liked this stream. What do you think? You think this was kind of a good one? Kind of do a little bit of travel medicine RP. It's kind of fun, and next time we can do a different area of the world, right? And let me show you the useful travel guidelines website that you can look at, where you can go with particular country information, and it looks for like warnings and stuff like that. This thing gives you the information, and so you can always look at that for your travel. And they even have a section here for adoption too, to help you get some information. You can learn about your particular destination. So for example, we put in Italy here, which is going to have a lot of warnings because of COVID. And then of course they're saying exercise increased caution due to terrorism is important. So, and they actually say no vaccination, but that's because they're missing some critical information. You want to go through the vaccines like I talked about, depending on where you're traveling to. So, but these are good quick facts that you can use for local health and stuff like that. You should still go to your doctor, to a travel medicine doctor, to make sure that you have everything before you go. And like I mentioned, like the air quality thing, this is pretty much all stuff that we talked about, pharmaceuticals, everything else like that. So there you go, and you can look at the fact sheet. Oh no, that's International Parental Child Abduction, not adoption. I'm so sorry. That's a different thing. So the fact sheet is kind of cool. It tells you all about the relationship between Italy and the US and everything else like this. Some of these things are a little bit incorrect sometimes, but it's pretty much the most up-to-date that you can get without going to a travel medicine doctor and getting like the full everything like I just did. Yeah, so Italy, huh? Pretty baller. So I'm actually just about to go, Gabby. There is a large amount of the advice that I gave is directly from my experience, but a large amount of it you can find in here. So a lot of the sexual health stuff is stuff that I know from my training and experience, but a large amount you could find in here if you wanted. I try to make things really transparent so that you guys could find things and you don't have to wait for you know, like I feel like that in medicine a lot of information is held. Oh, Gabby, Mr. Higglesworth is saying he hopes your I think rent application forms, all your paperwork and stuff went well. Yeah, Schooly JB, I feel like a lot of medical information is like kept under lock and key. Like they don't want people to know about it, and I think that's silly. I think that everyone should have access to it and should know where their doctor is getting the information. So I do try to let you guys know where the information comes from. A lot of the travel information, vaccine information came from here. The sexual health information came from vaccine inserts, like the stuff on the vaccine. Some of the stuff was based on personal experience, and then the CMDA human trafficking course is really excellent, and that's where a lot of my information comes from. A lot of my sexual assault information comes from the Military San Antonio SAMFI course, which does have some information that is publicly available. So I try to cite my sources, right? But yeah, it's not advice directly to you as a patient. It's like education, right? And there are doctors who do education classes and things like that. I'm actually going to be creating a class shortly on, I'm working on it now, I've started filming it, on how to have medical accuracy in science fiction and fantasy. So if you're a creator, if you like to make stuff, that'll be kind of a fun course to take. But yeah, try to make things that you like. Trafficking is a big problem in the United States. Let me give you my superhero alert classes that you can take on human trafficking wherever you are. Trafficking. Let me pull it up for you. This is the wrong thing. On this website, I list also a lot of really neat, on my like superhero alerts, I list a lot of really cool ways you can get involved in making the world a better place. And it's generally like, it's not nonpartisan. It'll be for specific action points for specific things. And there's malaria. Here's something on women's rights without frontiers in Asia. Here we go. So this is my, I just had to check. This is the Blue Campaign, Human Trafficking Awareness Training, so that you can protect the people around you from being trafficked, and you can recognize places where human trafficking is occurring. And we can do a class, a conversation on human trafficking. We're not going to do a role play on human trafficking because to me that's a little bit too traumatic. But we'll do this kind of, I can certainly give you information about it. And there's another class that I really love. I don't know if the CMDA class is available anymore. There is an additional training. Let me get you this training, the first training, and then this third set of resources. And I actually had a rule, basically, if people finish these trainings and show me that they've finished them, then I will give them, oh, where's the training from here? There we go. There should be a training on here, the Human Trafficking Hotline, which you can contact. Here you go. So the reward was going to be, I was going to send people $15 worth of merch and things like that if they finished the training and they proved to me, like with their email certificate, they finished training. This website also has some training, but I don't see the link that I had to the training. I think that you have to find stats from your state. So I don't always love Polaris. Polaris does some good things with human trafficking. Polaris also does some bad things internationally that are kind of unscientific when it comes to, so they don't do like evil things, but they have kind of an unscientific view on the role between prostitution and human trafficking. When to me, looking at the studies, and I have the studies saved, I can send them to you. To me, looking at the studies, it's very clear that legalization hasn't solved the problem. It's supposed to, and in theory it would work, but just because something happens in theory isn't what is really going on, and the studies that have been done have not shown that it's helped. In fact, it's shown that it's increased child trafficking in places where it's been legalized, because I think people aren't understanding psychologically why John, like they're not understanding the appropriate psychology of a John. And I think maybe that's why the theory is not matching up with the scientific reality. And of course, that's something we can talk about another time. This sucks because I think the CMDA modules are gone, and I loved the CMDA modules. I don't know why they're gone. CMDA human trafficking. There used to be this awesome course you could take, and I think it's gone. Online medical resources. Nope. I think that it is gone. That sucks, because there were a lot of groups that were using it. So I wonder what happened then to the group in the that sucks so much. What happened? I need to email them, I think. They have a commission on human trafficking, but what happened to their class? Human trafficking, human trafficking. Human trafficking, commission on human trafficking. And an online set of continuing medication modules on TIP. Yes, where did they go? What happened to them? Here's the Human Trafficking Resource Center, though. Here you go. Nope, I already gave you that link. Man, this sucks. This is where the course used to be that I took. So, they have a lot of good teaching stuff, but it's gone now. I'm gonna have to email them and find out what happened to my course that I used to take. They had a great CME course. So, anyway, yeah, I'll check that out. JC in the Woods. I don't know what that is. Looks like it's a YouTube channel. What a name. JC in the Woods, the one with 95 subscribers? May not have found the right thing. It looks like his stuff is gone. You should give me a link to his videos, because there's no videos on the thing that I just looked at. So, yeah, definitely drop me a link. JC on a bike, that's a different thing. Have I? Yes, I have. Yeah, I have. That was in Puerto Rico. So, not frequently, which is not necessarily a good thing. I wish that I had more opportunities to help people in those kind of situations. I also used to give medical care to prostitutes, and that's kind of how you get access, basically. So, all right, folks. Well, I thank you for hanging around for your travel medicine experience. We can do the same thing again some other time. I think next time we might do a D&D one. JC on a bike, there we go. A neurobiologist and bike seat journalist, that's fun. An academic neurologist. That's cool. That's super cool. Definitely, we'll check that out. Thank you. Or handle nukes. Alright, folks. So I hope that you have a lovely, lovely, lovely night. We'll probably do another role play like this again, but it'll be maybe the D&D one where we actually role play D&D like as if you are a character and I'm the healer of the group or something like that. Because somebody had requested that, and we might I may actually just do that as a YouTube video for that person since they were a channel member, and we'll try different kind of things, or we might do some, like we talked about, Magic the Gathering. So if I stream tomorrow, we'll just do chill reading. One of the things I really want to do is I want to read through this together. I think this could be fun, and we can talk about it. Like, the benefit of reading with me through something like a survival manual is I can help you review it and tell you about stuff that's bullshit and not, because of my Fellowship of Advanced Wilderness Medicine and my operational medicine training with the military. So I can give you conflicting resources and say, like, this says this, this says this, and that's kind of fun. We can argue with Tim McWelch and the editors of Outdoor Life, or we can say, yeah, Tim McWelch, you're right on, you're baller. Mango shouldn't have eaten the first page of your book. Don't buy birds. Like, unless you are really ready to have your whole house destroyed, or be very good at training them, don't buy birds. Dude, they have comic pages in here about cougar face-offs, which I can talk to you about because I actually just had to do a CME on cougar attacks with my fellowship. So things like that, like I can tell you like, okay, so this manual says this, but I happen to know that this study says this, and then I can link you the study. Just like I just linked you to the several websites and stuff like that that like weren't in the book, because this is the benefit of being a physician, right? This is the argument for why people don't want to make information publicly available, is they say you should have a physician analyze it for you. That's great, but physicians are very expensive. We're limiting access to the information, and I think it's better if we can analyze together. Right? If you can analyze, I can analyze, and we can talk, and we can have, you know, we can work together. In RD2, cougars kill me 90% of the time. Cougars suck, dude. Cougars especially like to go for children, and they usually like to go for the spine. That's something that they like. You should never ever run away from a cougar, because they love that. You want to be big and scary, and you want to hurt it if you can, because that usually that. So a cougar attack is very different from like a bear attack. A cougar attacks you planning on killing you, and it wants to do that more if you run away. I can link to you guys to the study at some point. Here, I'll link to you to the study right now. WMS, it's a wilderness medicine journal, and here we go, cougar injury. This is the review article, I think. No, this is the original research article. Here you go. Here is the original research article. I think this is the one I had to study. Yeah, where they looked at verified attacks. Interesting here, right? Persons less than 18 years of age were heavily represented among victims, especially if you're little. If you're little or you look old, they're usually very fatal. They're pretty horrible attacks. They will, if they can't get your neck, they'll go for your throat and face, which is pretty horrific. So that's, if you'd like to study how to avoid a cougar attack in your life, that is probably the best study that is available. There are not a lot of good studies on it. So as you can see, the N value is very small. There is a case report in 1992. That's not what you want. The study is going to be better that I just linked you. So I know. I get you. I'm not worried. I don't think that you physically see me. I'm not at all worried about that. You have to understand, I go to an AME church, so if I don't know certain colloquialisms, I would not be able to communicate with the people around me. I don't know why I'm doing this to my face. But yeah, I get it. I got you. Thank you. I think it's funny that you have to clarify. It tells me that you've been around a lot of people who don't understand what you're saying, which I apologize for. But yep. If a cougar bothers you at all, they intend to hurt you. Yep, that's the truth. So, and there's actually different protocols for different bears as well, different studies for different bears, and that's pretty cool and pretty rad. Like different things that you should do. So we'll see if these guys like live up. Oh, another thing I want to do with you guys. I want to practice with my lockpicking kit. We can practice together while I practice for the video that we're gonna do. And so I just have to get a little lock to practice on. But and you guys can practice too. And I think that would be good ASMR sounds, right? I think the little clicks of the little lock will. I don't know what the dude is with this guy. Like, he looks scary. I don't know why he's here. I don't know that he's necessary, but I have this scary, angry looking guy. So these were not expensive. These were pretty cheap. What do you guys think of the microphones being placed like that. Like that. I really like it like this. I'm gonna go back to the other setup for next time, but I like that. Like you can feel and hear and watch and see, so you can kind of get the visual trigger at the same time. Because I know sometimes people are triggered by seeing something happen to somebody, and at the same time it's like happening to you. So, and then also you and I can hear the same tappings. I don't love this sound of this thing. I think this one probably has better taps. I was not under that impression. So I bought lockpicks. I do know that lockpicks are illegal in some places. You get tingles from lockpicks. Are you a thief? Are you a professional thief? Do you get excited with the prospect of lockpicks making you INFJ? But I don't like the MTBI because I don't think that there's a lot of scientific evidence for it. And I think that people like me who fall through a lot of cracks, they're very sensitive. They're very, like, it makes me angry to do. Oh, we are like exactly the opposite. I love it, Gabby. We couldn't be more opposite, except on the high. I love it. I love it so much. So, yeah, so like I think it's a nice thing to look at, and if it helps you understand yourself. It made me very angry taking it because I felt like I couldn't answer any of the questions, and I felt like I fell right in the middle of everything. So it was very stressful to me, and it's not like something that psychologists would use, for example, to really assess you. It's kind of like a pop psychology, workplace psychology thing. Again, if it has its place, if it helps you to understand yourself and helps your employer to find you the best position possible, go for it. It makes me angry. That's okay. So, yeah, so next time I think it could be fun. We could go through this, and we can do it kind of in a similar like roleplay style like we did today, like hey, you're coming to study with me because we're getting ready for something, and we can like go through like that, and we can kind of read together, or we can straight up read it, depending on how we do. Gabby, I think that's funny. I like it. So, or we can do another, depending on how I feel, we could do another health roleplay like we just did, where we did the CDC travel thing, and we can do for a different area of the world. I can't believe they don't have like more particular stuff to Italy. Like some of that stuff is stuff that I had to pull out. So they have a lot of really good stuff for, oh cool. Oh, there, a lot of this stuff is like cool for a doctor and not as cool for you as a patient. Read anything that isn't graduate level and I'm game. INFJ Squadlo. Hey, Buffalo Corn Dogs, have you been lurking? Just ran over 5 children. Oh no. Alright. So, yeah, so that's that. I am gonna go now, but I really appreciate you guys hanging out, and I hope that you had a lot of fun. I hope it was pretty enjoyable. I tried again to talk to another scammer today, and they don't want to talk to me. They can tell. No one wants to scam me and steal my money. It's such a bummer. No. Oh, Buffalo Corn Dogs, I'm sorry. We are just about to go. We are just about to go. But it's good to see you. Very good to see you. So, I never like saying bye to you guys because I always want to leave you with more. I want you to know like how awesome it is to have you in my life. Even though like we can't all, like, again, it's the power of the internet, we can't all know each other, but we can all add to each other's life and kind of know each other, and that's so cool. And we can you know, hopefully I can add something to you guys. You guys definitely add something to me. And you know, in some cases, maybe we can do a little more, a little less, a couple different things. You know, and I think like I said last stream, a lot of times it's people that we would never have met or maybe not even liked each other in real life. But because of the internet, we can connect. The internet can also divide people, right? Depending on the community. It could be people who like each other in real life who then hate each other because of the internet. It's how you use it. And I think the power of the community we're trying to create together is that it can kind of bring together people who are really different, have free discourse, have opinions and things like that. And kind of, I think because we're coming together under the guise of comfort, not really the guise, under the goal of comfort, I think it brings together slightly nicer people. And I think, I don't know, I think it's kind of cool how we're able to communicate with each other. So, gives us an opportunity to look out for each other. So I think it's been a really great stream. Nobody asked me to put a microphone into my body parts, so that's great. It was a really great stream from that perspective. I appreciate that. Thank you everyone for behaving. And yeah, I'm gonna let you guys go. I hope you sleep well. So I hope you sleep well. Alright, good night. Good night. Sleep well. Sleep well. Thank you for being here, every single one of you. Pouncinator, Mr. Higglesworth, Grumpy Gabs, Buffalo Corn Dogs, Schooly JB, who else is still here? Hush Hush, if you're still here. Welcome and thank you. Thank you for being here and for always being so cool and positive. I think that you might be gone, but you are certainly welcome. Everybody. Yeah, everybody. Oh no, you left. When I said we were gonna leave in the beginning. Alright, bye guys. Good night, everybody.